And good afternoon. We await Governor Tate Reeves, and they are checking the mic now, is getting ready for everything in Jackson for his latest press conference. So we'll be joining that in just a few moments here to hear what Tate has to say about the latest that is going on with COVID. As she's doing a countdown. Yeah. So. Microphones are good in Jackson now. All right, as we wait for this, I hope you're having a wonderful day. Temperatures are heating up all across the state as we look at this. Currently, we're sitting at 88. Our heat index is sitting at 97 today already. Now, we're expecting about 100, so expect that to warm up before it's all said and done as we look at that. Everything is great so far. No rain. We've got sunshine everywhere, so we have no complaints on that. Still a lot going on in Afghanistan. No better as the news headlines just keep pouring on this. Biden is reportedly ready to make a deal with the Taliban to pardon a drug lord for exchange for a U.S. prisoner. We'll see how that turns out. That's one of the things that are happening now in Jackson as we wait for this. In Afghanistan from the Biden administration as we wait for COVID. There's a lot. I'd hate to be the governor at this point. There is so much going on with confusion, and hopefully the governor is going to clear up some of this. Maybe he'll address the threat of being arrested by officers, of medical officers. Boy, that went over really well in the state of Mississippi, didn't it? I don't think anybody liked that at all. I didn't care for it myself. So we'll see what he has to say about that, how we are this week. They should be coming out any moment now. Let's see, we're sitting at 11 o'clock, so they usually take within 1 to 2 minutes of the top of the hour to come out and begin this. So I'm going to back off. We're going to join now the feed live from Jackson to join the governor here in just a moment. So we'll be joining that here. Okay, let's go ahead and flip over and we'll join the live conference as it's waited for the governor to step out. Let me flip a couple buttons here and let's see here.
Sterling silver heart earrings.
You know, Eugene was better in hot food. He was. He was a good pro, but he wasn't psychologically quite right. But Harris was a lot better. Well, Harris was solid. Harris was just straight across the board solid. Good pro. Good pro. Yeah. Both stages of scoring league for a long time.
Good morning, and thank you all for being here on this Tuesday morning. 808 nurses, 3 certified registered nurse anesthetists, 22 nurse practitioners, 193 respiratory therapists, and 20 paramedics. These are the number of healthcare personnel beginning to deploy this morning to 50 hospitals across the state to meet the staffing shortages in our hospitals. This medical staffing was secured through utilization and awarding of 4 of the original 19 bids that MEMA received on August the 13th. Put differently, we are deploying over 1,000 healthcare personnel within 6 business days of the RFQ closing and within 9 business days of the Department of Health official ask. Of course, as you know, when in the middle of an emergency, there is no distinction between a business day and a Saturday or a Sunday. This, in my view, is an impressive feat, and I'd like to thank MEMA and the Department of Health for helping make this happen so quickly. Onboarding this medical staff will be phased in over time. Level 1 and Level 2 trauma hospital requests have already been fulfilled, and Level 3 hospital requests are currently being processed and fulfilled. I mentioned earlier that we are deploying to 50 hospitals today. We anticipate that all staffing requests for the 61 hospitals that made them should be met no later than the end of this week. In addition to the personnel I just mentioned, a 23-person active duty team arrived in Jackson as part of the Department of Defense COVID-19 response operation. 20 of the 23-person team are active duty Air Force medical personnel, while 3 of those 23 are part of a command and control element. Today, we are anticipating another 23-person team of active duty Army military personnel. They are in processing in preparation to provide assistance in Tupelo. Like the first team, 20 of those 23 will be medical personnel, and 3 will serve in a command and control element. U.S. Army North, under the U.S. Northern Command's oversight, will provide operational command of the active duty military COVID-19 response team. I've said this multiple times throughout this pandemic, but I'll say it again. My top priority throughout the pandemic has and will always be protecting the integrity of our healthcare system. We have been working around the clock to secure additional medical personnel through both federal and private sector sources to shore up the staffing shortages that our hospitals find themselves in. Getting boots on the ground this quickly is a step in the right direction. I'm grateful to each and all of the healthcare professionals who are working day and night to take care of our fellow Mississippians, and I'm grateful to those who are coming here to help. Having these staffing needs met will help to alleviate a portion of the strain on our healthcare system and ensure that all Mississippians that need care will receive the quality care they deserve. In addition, last week we administered over 81,000 vaccines. Of those, approximately 53,000 were first doses. We have now been distributing vaccines for 36 weeks in Mississippi. This number of 81,000 is the 11th highest total out of those 36 weeks, and it is the 6th week in a row that we have had week-over-week increases. It is the largest number of vaccine doses that have been administered in Mississippi since the middle of April. As I have repeatedly done throughout this year, I encourage each and every one of you to consult with your doctor, study the facts, and decide what is best for you and your families. I will continue to defend your right to make your own choices about your health care. That being said, the facts continue to point to the vaccine as being safe and effective and the best way to preventing serious illness and death as a result of COVID-19. According to the latest data, and I know Dr. Byers probably has data that is updated one day after this, but according to the latest data as of Sunday, there were 1,563 people in the hospital fighting COVID, which is down from our most recent peak of 1,667. 465 patients were in the ICU. The most recent data also continues to show that 98% of all new cases, 89% of all hospitalizations, and 87% of deaths are amongst those who were not fully vaccinated. While we have a long way to go, there is hope. We are now starting to obtain the medical personnel needed to alleviate some of the stress on our healthcare system, and we are continuing to see increases in vaccinations. I truly believe that if we all continue to do our part, if we all continue to work together, we will get through these challenges. Now, before I turn it over to Director McCraney and Dr. Byers, I would like to take a moment to discuss another item that has been in the news for months and will likely be in the news over the next couple of days. Tomorrow and Thursday, members of the legislature will be holding hearings to discuss the future of our state's income tax. I want to personally thank Senator Harkins and Representative Lamar for working on this issue and for having these hearings. I'm also glad that the Lieutenant Governor, the Speaker, and I all agree that the income tax should be eliminated and that doing so best positions Mississippi for long-term success. I hope that once the hearings are over, the legislature will realize that eliminating Mississippi's income tax is needed and reducing the tax burden on Mississippians across the board is the best way to ensure our state's economic prosperity. I hope that once the hearings are over, the legislature will realize that the best way forward is to not swap the income tax for increases in sales taxes, agriculture taxes, and other taxes. If you agree with me on that we should eliminate the income tax without raising taxes in other areas, I recommend you mention that to your legislators. I've said it before, and I'll say it again. I'm opposed to taking less from you here and taking more from you there. I'm opposed to robbing from Peter to pay Paul. I've been in contact with many small businesses across Mississippi, including in the manufacturing and agricultural space, with outside think tanks and many other stakeholders. Based on my conversations with them, it's clear. The consensus is that eliminating, not swapping, the tax burden is the way to go. Today, Mississippi stands in the best fiscal shape and the best financial shape we've ever been in, thanks in large part to Mississippians' willingness to go back to work despite this global pandemic. Thanks to them, Mississippi ended the most recent fiscal year over $1 billion above original revenue estimates. As Lieutenant Governor, I was proud to propose the largest tax cut in Mississippi history. We were able to get that done, eliminating the 3% income tax bracket without increasing anybody's taxes. We did it before, and it is my firm belief that we can do it again. Now is the time to get this done. We can no longer kick the can down the road when it comes to getting rid of the income tax. Every single day, we are competing with Texas and Tennessee and Florida for investment capital. Every single day, we are competing with Texas, Tennessee, and Florida for human capital. If this doesn't happen now, if we swap taxes instead of eliminating them, we will never be able to do away with them once and for all. With that, I want to thank Director McCraney and Dr. Byers for being here. I'll turn it over to Director McCraney first so he can talk about some of the specifics. Director McCraney?
Thank you, Governor. Just want to expound on what the governor kind of talked about earlier and give some specifics, and also to let you know that by Friday of this week, we will do a release on all contracts, all hospitals that have given orders. So we're still putting that together. But right now, it's 1,046. I mean, in 11 business days that we've been able to do and get out to the hospital. So what does that really mean? That means about 994 hospital beds. Specifically, that's 757 med-surg and 237 on the ICU side. So that's significant. That's going to relieve the pressure in 50 hospitals who've made requests, and as we work the next 11, we'll add those numbers in as well. So I think that's very important. I think there's another note that needs to be made. There was a lot of conversation early on about a state of emergency. When do you stop having a state of emergency? I can guarantee you, if I did not have a state of emergency in effect right now, we would not have done this in 11 days. It is impossible under state law to do that, but through the guidance of the governor and his staff and the abilities for us to operate under a state of emergency, we were able to issue those RFQs, the request for quotes, get those processed, and get these folks en route to Mississippi, which I think is significant. And that needs to be maintained. On the backside, I do want to talk about, and I can answer questions later, Tishomingo County had a storm over the weekend. I do need to kind of give them a shout out. We've got no destroyed homes at this time. We've got 8 major, 17 minor, and 33 affected homes up in that area. We had a tornado that came up very quickly on Saturday and over the weekend, as you saw some of the flooding in Tennessee. And we've had some of our staff there, as well as the local emergency responders. We've been responding to that since Saturday, and I'm glad to report that we have 8 Days of Hope. We also have VOAD, the volunteer organizations after disaster, have been deployed, as well as the Southern Baptist, and we've been in there with TARP missions, and we're also going in with our individual assistance officers to work with that county as well. Governor, that's all I have for right now.
Thank you. As has often been the case throughout the pandemic, Dr. Byers steps in very capably for Dr. Dobbs in his absence, and at this time I'm going to turn it over to Dr. Byers.
Good morning, everybody. Thank you, Governor, and I want to thank the Governor and I want to thank MEMA and the Director for their efforts in helping our hospital capacity throughout the state. I think this is going to make a huge difference for us moving forward. If we look today at our numbers we're reporting out, 3,291 additional cases, and unfortunately 111 additional deaths. Now, this is the highest total of deaths we've had to date so far during the pandemic. The previous high was back in January, when we were having our large peak over the winter months. When we look at those deaths, guys, we're looking at about 87% of them are not vaccinated, not fully vaccinated. When we look at the breakdown of the deaths, more than 50% of them are over the age of 65, and a good number of those individuals, 75 and older, 75% or more are not fully vaccinated. So we are still seeing an impact in our older individuals, and we do know that the vaccine is very protective for these folks at preventing the severe complications and illness that can occur. Now, when we look at our hospitalizations over time, we have begun to see some flattening off in our hospitalizations, in our ICU use, in our ventilator use. Today, we're reporting out 1,655 individuals who are hospitalized. So that's a little bit higher than yesterday. But if you look at the trends over time, it looks like we are leveling off in the number of hospitalizations. This is the good news, and I really want to talk about some of the good things that we're seeing right now. Number one, when you look at our cases over time, it looks like we are beginning to plateau. A couple of days does not a trend make, but it does look like we're moving in the right direction with our case numbers. It does look like we're starting to have some leveling off with our hospitalizations. Certainly, we've seen that with ventilator use and ICU admissions as well. But we have had some increased deaths. And we do know from our experience that when we have big surges in cases, that the deaths often follow several days later, once an individual becomes ill enough to become severely ill. And so we may anticipate some significant increases in our deaths still. We're going to watch that. And some other good things that we see are the impacts of monoclonal antibodies. And we do feel like that this is a life-saving measure. We feel like this is what is additionally helping our hospital capacity. We know that individuals who are infected, if they get monoclonal antibodies early in the course of their illness, that it can prevent hospitalizations, it can prevent deaths. And we've seen an increase in the utilization of monoclonal antibodies throughout the state. We've seen the increases in the vaccinations that the governor mentioned, and we anticipate that we'll continue to see those. Now, at the health department, we do have the availability for the third dose for people who are immunocompromised now. They can make that appointment on our vaccine scheduler on the website, and basically they're able to self-attest that they have an immunocompromising condition, and they are able to make an appointment for that third dose at a county health department now. This is good news. And additionally, and you all saw this, that the FDA did give approval for the Pfizer vaccine, full approval for individuals 16 and older. This is a great step in the right direction. We feel like that for many of those people who may have still been hesitant, may have still been on the fence, that we will see some increases in vaccinations as a result of that. And I believe that that's the report for today. Governor, thank you.
Thank you, Dr. Byers, Director McCraney. As has been the case throughout the last year and a half, I want to personally thank both of you for your service and to all of your teams. It's easy to sit on the back row and complain, and it's a little bit more difficult to be in the middle of the game actually playing. And you and your teams have been players, active participants in responding to ensuring every step of the way that everyone that could get better with quality care received that quality care. Our goal from the beginning, which continues to be our goal today. So with that, I'm going to open the floor to questions. I'll start, Courtney Ann.
Governor, have you made any personal visits to any of the hospitals in the state? I know a lot of the conversation today was about hospitals. Have you gone to any of the hospitals in the last couple of weeks as this surge was happening? We've heard anecdotally from many of these doctors and hospital administrators about just the nightmare that it is. Have you gone to see that firsthand? If so, how has that impacted?
I have not been in any hospitals.
Do you have any plans to?
I don't currently have plans to do so. I'm certainly not opposed to doing so. I know we have great healthcare workers that are working every single day, and quite frankly, I really appreciate everyone that is doing those jobs on a day-to-day basis, and I make myself available to you and the press regularly. And honestly, I think that those nurses and those doctors are better served treating patients than they are showing politicians around their facility. But again, it's something that I think is important is to restate. We've been working day and night to get reinforcements here because we know that we have significant additional capacity in our hospitals through hospital beds, but we don't have a significant ability to add patients because of the lack of staffing in our hospitals, and that's what we've been focused on. Scott.
What other restrictions or steps are you considering if this pandemic number continues to go up, get worse, or whatnot?
I don't anticipate any lockdowns. I don't anticipate any statewide mask mandates. I think if you look at what's happened in other countries as well as what's happened in other states across America, we've spent a good bit. I've personally spent a good bit of time looking at the Delta variant and its very, very quick and rapid rise in cases in the country of Israel. I've looked at the Delta variant and its very, very quick and rapid rise in the country of Great Britain. And what you find is in both of those instances, and then you also look at what's happened, at least initially, in the states of Missouri, in Arkansas, in the state of Louisiana. Again, a very quick and rapid rise in the total number of cases. What you then see is when the numbers start plateauing, they tend to decline relatively quickly as well. Now, we're not there yet. That's certainly what's happened in Israel, certainly what happened in England. It's what's happened. It's what's beginning to happen, it appears, although we're about 3 or 4, 5, 6, 7 days behind Missouri and Arkansas and Louisiana. It's beginning to happen there as you start seeing their total number of cases roll over. But we also know, and I want the people of Mississippi to be aware of this, we also know that deaths are a lagging indicator. We had our most deaths ever reported, I believe, yesterday, 111 deaths reported on this morning's report. Now, to be fair, that 111 number was over a multi-week period. They did not all happen yesterday. It's over a multi-week period, but deaths are a lagging indicator. You start with a large number of cases going up, and then over time, hospitalizations lag cases, and then of course deaths ultimately lag those in the hospital and those in ICU beds. So we need to be cognizant of that, and we need to be aware of that, and we need to know that where we were a month and a half ago with very few daily deaths, we're going to see an uptick over the next couple of weeks and maybe longer. But eventually, if in fact we, as Dr. Byers mentioned, we are plateauing and eventually rolling over the total number of cases, eventually the hospitalizations and the fatalities will follow that as well. Yes, sir.
This is for Dr. Byers. Back on the topic of boosters, what are the options for immunocompromised folks who got the Johnson & Johnson vaccine?
That's such a great question, thank you. And the question is about boosters for Johnson & Johnson recipients. And so the FDA is currently looking at that data now. Remember, we didn't start rolling out the Johnson & Johnson until March. And so it's a little bit behind when we started the mRNA vaccines of Pfizer and Moderna. So they're looking at that data right now. Certainly the FDA and CDC, and we agree, feel like that the Johnson & Johnson is giving individuals good protection from those severe complications. But it may well be that a booster is recommended for those individuals at some point in time in the future. I think the data is a little bit behind because they started vaccinating a little bit later with Johnson & Johnson. And so we do anticipate some additional information on that. Right now, though, we feel like those individuals who have received Johnson & Johnson vaccine are protected. But that's a great question. Thank you.
Yes, sir.
Governor, can you explain why you choose to take reactionary measures to protecting the state hospitals versus taking correctionary measures like we saw last year with the mandates?
What I would tell you is we are in the process of dealing with the emergency as we see it. It has been told to us by 61 hospitals around the state, which, by the way, according to your original question, I speak to individuals in the hospital pretty regularly. Some administrators, a lot of doctors, and a lot of nurses that I've had the opportunity to communicate with over the last year and a half. Truly many healthcare heroes. We're going to continue to meet the needs. The fact is that that the biggest challenge that is before us, as I've said over the last several weeks, is the lack of staffing within our hospitals, and we're willing to do whatever it takes to meet those staffing needs. Let's go, Bailey. You want to ask someone?
Hunter Dawkins from the Gazebo Gazette has a question.
Great.
Governor, thank you, Governor, and thank you, Bailey. 2 questions. The first question would be, is there an estimate of an amount of people that are unvaccinated that would get to the number of COVIDs that you would think about issuing a vaccine mandate? And then also, too, is there any possibility of the health department? I know there's been some news out about possibility of them trying to take action against people that have not received vaccines. And the second thing on the income question I had about cutting the income tax, as you as Lieutenant Governor, I know you've pushed this for a long time, but also being a numbers guy, what areas have, just cutting the income, there has to be some raises of taxes for somebody. And if you wouldn't mind speaking to that, Governor, I appreciate it.
Yeah, so to your first question, I have no intention of issuing a vaccine mandate, period. To your second question, I do not agree. I appreciate and respect your opinion, but I do not agree that you've got to raise taxes on somebody to cut taxes on somebody else. Not only do I not agree, we've proven it time and again over the last 10 years. Many of the same people who are screaming and hollering about the elimination of the income tax and the need to raise taxes on other people were screaming exactly the same thing 5 or 6 years ago when we passed the largest tax cut in Mississippi history. Again, we passed what was then nearly a $500 million tax cut. We phased it in over time, and what's happened is total revenues have continued to rise. What has happened is we find ourselves in a year in which the most recent fiscal year concluded, and we had literally collected over $1 billion more in revenue than was originally projected. And so if in fact you were to look at the $1.8 billion that we collect in individual income taxes today, we collected over $1 billion total in the most recent fiscal year. That was over and above estimates, then that was over and above what was spent. And honestly, if you consider the 2% set aside, it was really closer to over $1.1 billion. So we could very quickly eliminate a big portion of the income tax just through that revenue growth that has transpired. And then we could eliminate over time, and we could even put in triggers if that's what the legislature felt they needed to do, so that as revenues continue to grow, that we would see continued reductions in the income tax. It doesn't have to be done overnight. Bailey?
Nick Juden from Mississippi Free Press has a question.
Great.
Hey, thank you. So I'd love to hear from all 3 of you on this if possible. Obviously, we're seeing a huge new influx of healthcare workers. In previous weeks, we heard real fears from hospital leadership that this wave could put hospitals across the state on full diversion. Are we confident that these new workers have put that fear behind us? How easily can we expand this workforce if needed? And how long can we expect them to shore up the state's response?
So, Nick, to answer your question, these contracts that have been put in place are for a time period not to exceed 60 days. We clearly have the ability to renegotiate, but I am confident because we have fulfilled, if not all, the vast majority of requests from the hospital executives themselves, all of their staffing requests, that this is going to eliminate any challenges that may come before us. Clearly, if we are not plateaued and if numbers continue to significantly, if they were to significantly increase, then we would deal with that at that time. And the only final caveat that I will mention, Nick, is, and I know a lot of people don't want to hear this, but it's true. In this particular surge of the coronavirus, the states in Missouri, Arkansas, Louisiana, and of course us in Mississippi are on the front end of this Delta variant wave, in my opinion. What you're seeing now is more and more states are seeing higher and higher cases. And so what I think you're going to see is as we progress forward, there are going to be more and more states that are in need of these additional healthcare workers. Obviously, the increase in demand for them is going to cause the price to go up, and it's going to make it even more difficult to ascertain the help of these entities. And so it's why it was so important that we act swiftly to meet the needs that are before us, and we'll continue to do so. Dr. Byers, you want to go next?
Thank you, Governor. No, and I would say, you know, I think we're in a pretty good spot right now. I think what's going to be important, and I think Mississippians are showing us that they're willing to do this, but I think the things that we need to do to continue to protect the hospitals and protect those folks that are working so hard in the hospitals is to continue to increase our vaccinations. And we've seen more and more Mississippians who are willing to do that. And if you do get sick, if you do get infected with COVID, talk to your provider about getting monoclonal antibodies. This is life-saving. And you know, on our hotline now, and you can call the Department of Health hotline, and we can give information about resources of about what monoclonal antibodies are, but in addition, where individuals can find those monoclonal antibody providers near them and help facilitate getting them into it. So I think that as long as we continue to do these things, we're going to see the needle move. You know, I think we're going to start seeing some benefits soon of those increased vaccinations that we've seen over the last several weeks.
I'll just add in on the back end of the staffing that the governor alluded to. First contract is for 60 days. I've got options to continue those on after as long as we need it. We looked at the 8.5-week time frame, and that's what we originally wanted to go with. Talking to Dr. Byers, and others, that is what we needed to originally go with, but we can extend that for however long we need it, and that goes to back football season. You've got accidents there. You've got people going to the hospital for other things besides COVID. So we're in competition in those ICU beds as well as the med-surg beds for regular admissions as well as COVID.
And I'll just conclude that conversation by saying there is no state law which precludes individual hospitals from hiring staff. We've made the decision to do this because we want to protect individual Mississippians. Emily.
I wanted to ask about the planning process for the possibility of nurses and other healthcare professionals being offered more money to go to work for private contractors and leaving their current employer and maybe going outside Mississippi to work to make more money. It's a reality that's been happening across the country. What are the contingency plans in Mississippi to deal with that situation?
Yeah, there's no question that we have seen a reduction of some 2,000 total nurses in our hospitals. They've gone into private doc offices. They've gone to work for staffing companies. They've decided to travel and get paid more. And in some instances, they've simply retired. And so the first thing I will tell you with respect to nurse retention is it is the responsibility of the healthcare provider to ensure that they have adequate staffing to meet whatever their demand is. That's first and foremost their responsibility. We have stepped in here because that was a responsibility that had to be fulfilled, and in an emergency situation we had the ability and the authority to do so, and I'm glad that we did. In terms of overall planning, I'll let I guess Dr. Byers, if you want to talk about that. I don't think it's MEMA's responsibility to keep individual nurses here. I think it's a healthcare no more than it is for MEMA's responsibility to keep other individual employees at private employers here. Clearly, wages. If in fact there is an issue with wages, then they're going to have to meet that. So, Dr. Byers, I don't know if you have any comments.
No, thank you, Governor. And you know, it is a challenge. It's nurses and it's other healthcare staff that we've lost in the last several months, and I think that there's some things that we can do. I think one of the things that we've done is working with MEMA to try to get additional staff, retaining staff, and having competitive salaries and bonuses for staff is something that we're just going to have to continue to look at and work through.
Yes, sir.
With the FDA approving the Pfizer shot, getting it full approval, do you think, you always said that you encourage people to talk to doctors and make the right decision. Do you think the quote-unquote right decision's been made easier for people now that there's a shot with full approval?
I do think that the full approval removes a potential roadblock that some people had. It wasn't a roadblock for me. I got the shot in January, but it certainly has been used as by some to say that they would. Really, lots of people across the country have said, I may get the shot, but I want to see full approval by FDA before I do so. And so for those individuals, then clearly that was a step in the right direction. For me, the other point that I'll just make is, initially there was some conversation about the size and the scope of the clinical trials, which was a valid concern and a valid question. And what I said then is, at the time, the Pfizer vaccine had a clinical trial scope of about 40,000 individuals. There are many medicines in America that have been approved that had far fewer than 40,000. But even so, at this point in Mississippi alone, we've had 2.46 million shots given. We're in the midst of the largest clinical trial. To the extent that it is a clinical trial, we're in the midst of the largest clinical trial in a long time, and in our state, in America, and across the globe. And so I don't know that individuals. I don't know how many individuals there are out there that will now go get the shot because the FDA has approved Pfizer. But again, it has got to be a roadblock that has been eliminated for some. And I think across America that number is fairly large. Yes, ma'am?
With the lack of staffing, Governor, are you considering today possibly calling a special session to help address Mississippi's hospital staffing shortage?
At this time, I don't have any plans to call a special session. Bailey.
Annie Summerhays from Y'all Politics has a question.
I have a two-part question. The first part is for Governor Reeves. When the Mississippi Department of Health issued the isolation order last Friday, was there any coordination with your office prior to that recommendation?
No.
The second question is for, The second question is for Dr. Byers. The order says those who are positive for COVID must isolate for 10 days at home. Are there any exceptions to that when seeking treatment for those who might be confused, or are there any additional exceptions to that order as well?
Certainly, we want individuals to seek treatment if they need to, but the intent of the order, and I have to tell y'all guys, let's set the stage. This is not a new order. This is an order that we released back in 2020. This was a reissue of the same order that's been out there to remind individuals of the seriousness of COVID, and that if you are infected, the best way to limit transmission is to isolate yourself, is to keep yourself away from other individuals. And certainly there can be exceptions for seeking treatment, and you know, that's part of the process. But again, the intent of this is to remind people that if you are infected, the expectation is that you will isolate.
Dr. Byers is correct. This is not new. It is, and it also, by the way, in my view, is the way in which the vast majority of individuals who test positive for COVID are acting. When you test positive for COVID, you self-isolate. That's what you do. If you have close exposure and are unvaccinated, you should also quarantine and self-isolate, in my opinion. And so, again, it is a reminder to individuals that if you're positive for COVID, then you are most likely contagious. And if you're most likely contagious, the best way for you not to spread it is to not come in contact with somebody. Scott.
Governor, how much is this contract employee labor going to cost us? And specifically, where's the money coming from?
I'm going to let Mac give you an exact number, but I think if you said $80 million, you'd get really, really close. And the money is, this is a Stafford Act eligible expense, and under the existing federal decree, 100% of that will be provided and paid for by FEMA through the Stafford Act. We have asked for, because the numbers are fairly large, we have asked for expedited reimbursement by the feds. I don't know if I haven't talked to Mac in the last few hours. I don't know if they've agreed to that yet or not, but we've certainly asked for it. If they do not agree to that, then we will cash flow it internally. We have the state law and the mechanisms by which to do it. You want to give a specific number?
Perfect. Governor's been reading my notes. That was actually very perfect. About $10 million a week is what this is going to cost, the initial push. And we have asked for an expedited. We're compiling all of those numbers together out of the 61. And we're going to do it just like every other emergency that we run. We try to front load as much as we can. When the governor was lieutenant governor, the disaster trust fund never went low, and we've still got that in effect, as well as even for our other disasters. So it's not just COVID we're running. I have 18 federally declared disasters in the state of Mississippi that are open right now. I averaged about $365 million worth of payouts to the locals last year. So we continue at day 534 of COVID to still operate under the others as well. So we've got it. We're able to do it, and everything's spot on, sir.
Thank you. Jeff.
Two tax questions. You've said numerous times as far as a tax swap, you're opposed to that. Is that something you could definitively say would face a veto perhaps at this point?
What I can tell you is I believe that we can eliminate the income tax over time without raising taxes on anybody else.
Then the other part of that, there's also been some talk of cutting, I guess, in half the grocery tax. Where do you stand on that with the grocery tax?
Look, my entire career, I've been strongly supportive of reducing taxes on hardworking Mississippians. I think we should eliminate the income tax. If they send me a bill that just eliminates a bunch of other taxes or reduces a bunch of other taxes, I'd probably sign that too. Yes, sir.
Yes, Governor. The school report came out from the Department of Health, and last week, 5,500 students and nearly 1,000 teachers tested positive for COVID-19. I was curious what your thoughts are on seeing this continued transmission in schools.
Well, I don't think that you can necessarily make the leap from those individuals testing positive to the transmission occurring in schools. Some of it most likely occurred in schools. Some of it most likely occurred in the community. And so I think it's important that we make sure that we don't jump to irresponsible conclusions without having the data to verify that. But there is no doubt that we have kids and teachers throughout the state that have tested positive. We have kids and teachers throughout the state that have been required to quarantine, and that wreaks havoc on many individual schools, individual classrooms, and individual districts throughout the state. But I still believe very strongly that having our kids in the classroom is vitally important, and in the long term, the risk associated with not being in the classroom is greater than the risk associated with being in the classroom. Bailey?
Tom Dees from Fox 13 in Memphis has a question.
Okay.
Governor, if you would, what do you attribute the increase in vaccinations to? And we're one of the least vaccinated states in the country. What do you do to change that? That's question one. Question two, can you speak to the help coming to Baptist DeSoto and Methodist Olive Branch here in DeSoto County? And can you speak to the possibility of a field hospital?
Yeah, so the first question with respect to vaccinations, I think that as more and more of our fellow Mississippians get more and more information, they are more and more likely to make the decision based upon the facts. And I think the facts are becoming more and more clear that we find ourselves in large part, certainly with respect to hospitalizations and deaths and new cases, that we are in the midst of a phase of the pandemic of the unvaccinated. And I think that's one of the reasons that more and more people are getting vaccinated. There are a lot of other reasons, by the way. School just recently started back, and so I think there are a lot of kids that whose parents were going to get their kids vaccinated, but they chose to procrastinate to a certain extent, because back in May and June and July, the numbers were, or early July, the numbers were so very low that there wasn't a sense of urgency. And as the numbers started to rise, that sense of urgency became more and more urgent. And so I think you're seeing a good many of our numbers today are that, because I hear about it pretty regularly. And so I think that's part of the issue. And then I think, the other hurdles that are being removed, like the FDA approval yesterday, there's just a myriad of different proposals. I can't personally speak to the requests that were made by the two hospitals in DeSoto County, because I don't know exactly what they were, but I do know this. We have 61 hospitals that by the end of the week will receive the help that they have requested. And if those two hospitals in DeSoto County made those requests, then my gut is to tell you that they will have met, those needs will have been met no later than 2 to 3 days from today. Mac, I don't guess. Yeah, I don't. Okay.
On the back side of that request, you alluded to field hospitals, and almost 90% of the hospitals in the state are authorized under the Stafford Act to request reimbursement for if they want to open up a field hospital. But what we've done is empty beds are in hospitals. So we've gotten and authorized and gotten staff to go into, and you're going into an environment that already has oxygen flow that's needed, already has all the services in there, whether it's food, pharmacies, everything else. Why create another hospital outside of a hospital when that hospital is not being totally utilized. That has been the format that we've done up to this point. But those hospitals that want to entertain a field hospital, please call MEMA, and we'll get you enrolled into the system, and we'll make sure that you can fill out your paperwork right, and we're the ones that will help you do the project worksheet to get you across that line if that's the way that they choose to go.
Bobby.
Governor, back to taxes for just a second, if you will. There's studies that show in Mississippi, the poor people, because we're so dependent on the sales tax, pay a lot greater percentage of their income in taxes and state taxes than do wealthy people. Seems like you would just be escalating that by just reducing the income tax. I mean, is that your intent to?
Actually, it's exactly the opposite, Bobby. It's exactly the opposite. If everybody pays the same sales tax and nobody pays income tax, then what actually happens is the people who are currently paying a higher percentage of their income pay the same percentage of their income as do those who are currently paying a lower percentage of their income. So in other words, if you look at those individuals that have a lower amount of taxable income, if they're paying 5% of it in income taxes, 7% of it in sales taxes, then that 7% in sales tax is a higher overall percentage of their net income than what the individual who is earning much more and therefore not consuming 100% of their income. So the analysis is exactly the opposite of what you just laid out.
You have to set down this plan. I mean,
I'll be happy to. Yeah, we'll definitely do that. Well, because it is the income, the use of taxes based upon expenditures, I think will certainly drive that. So, yes, ma'am.
So we have some viewer questions. This is perhaps for Dr. Byers. So Dr. Byers, when students and teachers must test due to COVID exposure, I guess people are asking, why is there no specific site for them to go to? And then why are teachers held accountable with their own personal days, no pay, when they're out due to COVID?
So I can't answer the question about the accountability for teachers, obviously, with their leave status. But I can tell you that we do have testing available for students and teachers who are exposed. Certainly one of the things that we've done is we've worked very hard to make sure that that testing is available on site to the schools. And we have that through a couple of programs. One where we've provided testing supplies directly to the schools for them to be able to utilize that test. But we also have a vendor that works with the schools throughout the state to provide tests. And we have, in many counties throughout the state, we have our drive-through, or not drive-through, but testing in our county health departments. And we're continuing to expand that testing. And so I would encourage folks to look at our website, look at where those testing sites available are, and we do have that free testing available.
Dr. Byers, just a follow-up. If one kid in the house tests positive for COVID, do all of the siblings also need to quarantine from school?
They would if the siblings are unvaccinated. Yeah, if students are exposed to a COVID-infected individual, whether that exposure occurs at school or whether it occurs at home, those individuals are still exposed to COVID, and we recommend that they quarantine for that full period, even if it's of a sibling.
And to your first question, actually, the extension of the emergency order allowed for local governmental entities to allow employees that are on required isolation or quarantine orders to not have to take personal leave. Now, the governmental entity, the local governmental entity is not required to do that, but one of the reasons, a very small part, but one of the many reasons we extended the emergency order was to give local governmental agencies the ability to do that. Now, if you're a teacher or an employee, the best way for you not to have to be put in a position where you're trying to be convinced whether you're going to take personal leave or not, is to not get COVID, and to be vaccinated certainly reduces your risk. Doesn't eliminate it. It reduces your risk considerably of that. So I'm going to ask one more question, and we're going to have to go.
Just a quick two-part question on vaccines. The first one, I know that it was asked about vaccine mandates, but what does that mean for state employees? Could an individual agency director ask that their
Not one that reports to me.
And then secondly, the White House vaccination coordinator, we understand, is in town today meeting with public health officials in the area. Just wanted to get your commentary on that. This would be the second time that someone from the White House has come to Mississippi in regards to vaccines.
Yeah, so I think there's a concerted effort by people of all political stripes to encourage individuals to get the vaccine. And I think that's healthy. If you look at our state, and again, I know that there's been an attempt, not necessarily by people in this room, but certainly by the national media, to try to convince folks that those who are vaccine hesitant in America are primarily rural Trump voters. It's just not true. I understand that that's what's been sold by some of the national media. That's just simply not true, at least not in Mississippi. If you look at the total number of individuals that have gotten vaccinated in our state, we have a total African-American population that is about 37 to 38% of our total population. Our total number of vaccines, about 37 to 38%. Have gone to African Americans, and so the way in which math works is vaccine hesitancy in our state is and we spend a lot of time and effort convincing all communities to figure out and look at the facts. But the vaccine hesitancy in Mississippi is about just like the total number of shots is proportional to the population. The vaccine hesitancy in Mississippi is about proportional to the demographics in our state. And so, again, I encourage anyone that will encourage their friends and their neighbors to get the vaccine to do so. But I'll also tell you, a lot of y'all been around a long time and have heard me during political campaigns. I'm someone who believes very strongly that political popularity is really not transferable. And so when politicians endorse a particular candidate in an election, it really usually doesn't have a whole lot of impact. And I'm not sure that politicians endorsing one decision or another has a lot of impact. What does have an impact, however, is when you talk to your friends and your neighbors and you talk to people who respect you and you advise them as to why you made the decision that you made. You know, it doesn't do a lot of good to have people having a bunch of press conferences preaching, explaining to people why they're so dumb for having not made that decision yet. It does very little good. In fact, I would argue it probably does more harm than good. But if you sit down with your peer group, the people you go to church with, the people you go to Sunday school with, and you simply say, look, I've done this research. What research have you done? And talk to them. I made a decision to get the shot because of these three reasons. That goes a lot further than some politician standing up or someone else standing up and preaching and telling you what you ought to do. So again, it's I think our numbers really show that as we've seen over the last 6 weeks, every single week increases in the total number of individuals that have gotten vaccinated. We've got just shy of 1.4 million Mississippians that have taken the first shot. That's really over half of those who are truly eligible. We've got 2.976 million people in our state. A big portion of those, some probably 10% or so, clearly are under the age of 12 and therefore are not eligible for the vaccine. And so we're seeing upticks in the uptake in the vaccine. And because of that, I think the combination of a lot of different things is leading to our numbers stabilizing, to our numbers plateauing, or at least it appears over a few days. We'll see where we go from here, because as Dr. Byers so appropriately said earlier, 4 or 5 days does not a trend make, but it is certainly, when you look at the total number hospitalizations from August the 9th to August the 27th. Over about a 10-day period, we actually saw about a 7 or 8% increase over the 10 days. And so we're actually seeing less than a 1% increase on average over those 10 days. Hopefully that continues. Thank you all for being here. As always, I want to thank MPB for their work and their efforts in setting this up such that we can speak directly to the people and also give members of the press from other parts of the state an opportunity to ask questions. We appreciate all of you, and talk to you soon.
Governor Tate Reeves live in Jackson today with the latest numbers and whatnot coming out this week about the vaccine, what Mississippi is. Now, as we analyze what we said, there was not a lot of new information that was put out there. A lot of the same stuff that he said came from last week. I think you could summarize this up into as a meeting to show you this is what has happened this week with the emergency response. As he said, we now have 1,000 new medical staff in the state of Mississippi spread out over 50 hospitals. Tupelo will be getting some people tomorrow. As we look at this, one of the questions that was brought up was that brings 1,000 more medical field to the state of Mississippi. If I read the numbers right, we've had, and y'all correct me, I know some of the medical field is watching here. We've had, roughly 2,000 nurses quit, go on the road, go to work for a private practice. And he really didn't answer when he was asked the question of what is the state going to do to keep nurses in the state of Mississippi. He danced around that and threw the question off to somebody else. And their response was that each hospital should have to pay more wages, most likely. He didn't address it that the state would do this to do that. And then I've noticed comments, and y'all have seen this, to where people are saying, well, a lot of the nurses are leaving because they do not want to get the shot. They were going to be forced to, so they resigned instead of taking the shot. He didn't address that. Several things that was never addressed are brought up during that. And that was about the horse medicine. That was never brought up. It was never also brought up or questioned about medical, what's the word I'm looking for? The medical police that were going to come arrest you if you spread the disease or get thrown in jail and the fine. None of that was discussed in this. And I feel like it should have been, but there was no one that brought forth that question to the governor there. As we look at some more notes that I had, I mentioned the 1,000 in the medical field being brought in. 50 hospitals are taking part of this money that is brought in, $8 million, $80 million total, $10 million a week, $80 million total before it's all done. 61 hospitals have asked for help in the state of Mississippi, so that leaves 11 more that will get help that have not been added to this program yet. The numbers were still the same. Of deaths, how many people had taken the vaccine. Of the 87% of deaths, they had not taken the vaccine shot, as they asked you to do this. Now, I will give him credit for, he stood firm on he's not endorsing it either way, that you as a Mississippian should have the right to choose whether you want the vaccine or not. It's between you and your doctor, and he was right that a politician taking a stand on this wouldn't sway, and it really doesn't, that the people that convince you whether you should take a shot or do it, it's just like when you have some work done on your house, or you take your car somewhere, you ask someone that you know, somebody in your community that you trust, that's a friend of yours, are you getting the shot? And he said that is the biggest influence that there is. And I agree with the governor on that. There's a lot of things, as I said, that they jumped around on, and they just, they're not going to answer in a press conference or don't want it brought up, I'm sure. 1,065 people in the hospital. Let's see, I saw that. The question brought up about Pfizer being approved, and this is divided. I see this every day on here. On anything that I post that deals with COVID, there's some for it, there are some against it. I don't think it has had time enough with the Pfizer being approved by the FDA, because a lot of people were saying, well, it's not FDA approved. That was said a lot. From the comments I'm seeing, if y'all tell me if I'm wrong, that still hasn't convinced with that being approved a lot of people to go, okay, I believe in it now. The next question that people bring up is, well, what's the long-term effect? The FDA cannot tell me that. I'm not sure if that question can be answered. Do y'all know what I mean by that? I'm very unsure. Now, I invite you tomorrow morning locally, and that's what we are. We're you know me, I know most of you that watch, that we have a lot of people that join us from out of state, but on a local level, the folks around here mostly know me, and I try to shoot you as honest as I can. And so tomorrow morning, we're bringing in John Anderson. He is the CEO and president of Anderson Hospital. He'll be here from 8 until 8:30 with us to answer questions and talk about just how bad this is locally. What's happening to the people in the Meridian area that are brought in. That includes Philadelphia. You know, there's people brought in from all areas that watch me in this area. All of these 13, 14, 15 counties that surround us come to the hospitals here in Meridian, and we'll get firsthand. He's in there every day. We're not. I hear horror stories. Is it as bad as I hear? He'll be able to tell us, is it giving us a break? And he'll be as honest. I've known him for a long time. He'll be as honest as they come about this and be very candid of where we are in Meridian on this. People lose their lives every day. And again, no one can make that call for you to get that shot. Again, it gets brought up. I hear it in conversation everywhere I go. Sometime, as the old saying, we hold court out at Freeman Tractor of the different people that come in. And it's interesting sitting there listening to the different people that come in to buy a part, and they always give their opinion of what they believe in and what they don't. And just sit back and listen to what people are saying. It will not, taking the shot will not keep you from getting it. From the best that I can understand, it makes it not as bad and gives you a better shot at not dying. Now, I do not know anything about the long term. I do not know what will happen 3 years from now, 5 years from now. I'm not sure anybody knows that. The here and now, it does look as though it is helpful. But we'll ask that question tomorrow morning because it's a very serious question. And again, I don't know that anybody knows it. I want to remind you that tomorrow afternoon, Fire Station number 1 in Meridian, Mississippi, they're going to be handing out face masks and also hand sanitizer. So if you're low, and it's going to be several locations that they do this over the next few days, but this will be our first one. Again, that's Fire Station number 1. That's right down from Rush Hospital and also Anderson Hospital at the end there, that nice one on the hill. That's where they'll be doing that. And that begins at 3 o'clock tomorrow afternoon, and they will do that through 6 o'clock. Again, the Pfizer shot, 16 and older, can take it. I'm looking down. They asked the governor, had he visited any hospitals? He bluntly, and he answered no. He had not, nor does he plan to, that he didn't want to interrupt what they do to help people. I can see that. I'm sure he is on the phone with them a lot. He was asked several times about being a mandate. He says no, that there's not going to be a mandate whatsoever, whether it be for mask or for taking a vaccine shot. He doesn't plan on doing that. You're a grown-up. You can make that decision on your own. I was looking down. I think that's most of the notes that I took from this. They feel like one of the other comments that was made was they feel like that this has made a plateaued, so to speak, that we've gotten to the worst of it. They've got 2 or 3 days worth of numbers. That's not a complete week, but it does look to them that we've plateaued at the worst part of this. So we'll watch this. That's sort of where it was there. And I appreciate each and every one of you watching and putting your comments here so others can read it. That's where we learn. No one's ever been ugly. Everybody gets along. If you don't agree, you question. And I appreciate that. Again, I invite you back tomorrow morning, bright and early. Be here 8 a.m. We'll do this. And we'll find out a little bit more from John Anderson as what his thoughts are. Also, we'll have Cindy Covington in tomorrow filling in for Candace as she's off this week taking care of family. So a big thank you to Cindy coming in the morning. A big thank you to former chief this morning. Had a lot of fun with Chris being in the studio with us today. Again, thank you for being a part of this. You are what makes up what we do here, and I can't thank you enough for being a part of it. And again, we'll be back bright and early tomorrow morning, beginning at, I have a first broadcast at, 6:30, and then we come back at 8 live. And as always, should something other than the heat today, and let me tell you where we are on this before we break loose. Let me update this to make sure I've got the latest heat index, because it's kind of bad outside right now. We're sitting at 93 degrees And the heat index is 101 in the Meridian area. And this stretches up toward Philadelphia in these areas there. It could be 94 in the area where you are. But that heat index has topped 100. 101 is where we are right now. So we'll see you very soon. And thank you for coming by and spending a few moments with me this afternoon. As always, thanks. And we'll be back with Scotty Ray's Weather.
Scotty Ray's Weather is brought to you by